Yep, and you hear so often how deadly fentanyl is. One pill can kill. That was Brooke Schaefer reporting. Here to talk more about the dangers and the risks, emergency medical physician and medical director, Dr. Richina Bicette-McCain. Thanks, as always. So fentanyl, we know, is deadly, right? We're trying to get the messaging out on that the one pill can kill. But then when mixed with opioids, how much more dangerous does this become?
Well, fentanyl, we know, is about 50 times more potent than what used to be the most common opioid, heroin. Now, when you're combining fentanyl with other medications, essentially fentanyl causes an opposite reaction of stimulants. It causes respiratory depression. It can cause people to stop breathing. And that's the biggest risk of overdosing on opioids. The fact is, Marni, that although there are medications like Narcan, naloxone available behind counters and over the counters, those medications only last for a few minutes, and opioids can last in the system for hours. Something like methadone can last over 24 hours. So these drugs can be very, very dangerous in overdose if not treated by a medical professional.
And if fentanyl is mixed with one of these other drugs, does it diminish the capability of a Narcan to do what it's supposed to?
It doesn't diminish the capability, but Narcan does not work for other classes of medications other than opioids. So while Narcan can help if someone overdoses on fentanyl, if they overdose on something else, such as cocaine or methamphetamine, Narcan will not have an effect on that.
What will it take to shift the risk and the threat away from fentanyl? Because it feels as though every day we're talking about more and more people who are dying either by taking the drug intentionally or by accidental overdose. What is it going to take to change the conversation and really relay the deadly threat of this drug?
Well, awareness is the first step, Marni. There are a lot of people who are accidentally overdosing on fentanyl because they're taking drugs that are laced with fentanyl, even though that was not their intention. So promoting risk reduction strategies, such as using fentanyl test strips if you are going to indulge in illegal narcotics. In countries like Canada, for example, they have facilities where people can go and use drugs safely, where they are monitored in order to help reduce the chance of overdose. There are other controversial strategies, such as psychotherapies involving monetary gifts to people who are not using or who can prove that they have been abstaining from drugs. So there are things that we can do, but it is going to require increasing conversation and a shift in our mindset.
Yeah, education and some creativity, it sounds like. Another drug, MDMA, also known as ecstasy or Molly, could soon be prescribed to help treat post-traumatic stress disorder. There was a study published that said the drug combined with talk therapy has shown to be effective in reducing some symptoms. The company behind the prescription psychedelic is hoping the new data is enough to convince regulators to legalize it, and says they'll submit the results from to the FDA for approval. PTSD impacts about 5% of adults in the U.S., and doctors say the current treatments help an estimated 50% of patients. What's the medical message on this and the risk?
You know, I find this conversation very interesting. This is not the first time that psychologists or psychiatrists have explored the use of illegal substances in treatment of mental disorders. We've seen LSD or magic mushrooms and other psychedelics be used in similar veins. However, this is a very slippery slope. And I think one thing that people forget or conveniently don't hear when we talk about using these kind of substances is that they're not being used alone. They're being used in combination with psychotherapy. These substances are illegal for a reason. So while there are maybe some small studies which have been sponsored by these pharmaceutical companies that could potentially show a benefit, there are still risks involved.
Important to take note and talk to your doctor in each of these situations. Dr. Richina Bicette-McCain, thank you for your information as always. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.